Hello and welcome to this video on the how-to of transcutaneous vagus nerve stimulation, or tVNS for short. My name is Andrea Parker and I'm an occupational therapist with experience in the use of tVNS. So there are currently several tVNS devices on the market approved for the treatment of various conditions, including epilepsy, migraine, depression, anxiety, insomnia and pain. In addition to this, research has shown that tVNS may reduce inflammation and it also may stimulate neuroplasticity. So as such, it's being explored as a therapy to treat a range of neurological conditions and inflammatory conditions, including ME/CFS, that's myalgic encephalomyelitis, also known as chronic fatigue syndrome, and also long COVID. So I look forward to seeing where the research goes and whether it may be a safe and effective treatment for a range of other conditions. So in this video I will focus on the use of tVNS using a device called the Parasym, which is sold specifically for tVNS, but also on the use of standard off-the-shelf TENS devices that can be adapted for tVNS. So these are the topics that I'll be covering in my presentation. So feel free to jump in if there's a specific topic that you're interested in. So to begin with, the Parasym and standard TENS devices. Well, what is a TENS device? So that literally means transcutaneous electric nerve stimulation device. And these have been around for a little while. This is one example, and they're typically used with these sorts of pads which are applied to various parts of the body to treat pain. So it can be adapted for tVNS by adding on an ear clip to the lead wires. So the Parasym is a TENS device that has been optimized for tVNS by having a reduced range, because you only need a very low range of intensity for tVNS, and it comes with an ear clip electrode like that. So it is best suited to tVNS only, whereas a common TENS device can be used for a broader range of purposes. And this chart just shows some factors to consider when comparing a Parasym with a standard TENS device. For more information on TENS devices that anecdotally some people have found useful for tVNS, I'd encourage you to check out a Facebook group called A Vagus Adventure by Dawn Wiley. The vagus nerve has branches at two sites at the ear, namely the cymboconcha and the tragus. For the purposes of this video, I'll just be looking at electrodes that are suitable for the tragus. So the Parasym electrode looks like this. This is the soft version. The standard version that comes with your order would be blue and black, which is a firm one. And these are only available to people who've actually purchased a Parasym. So if you've got a decent sized tragus and you don't have any sensitivities to metal, this should be fine. If you have a small tragus, you may find that this falls off, and if you have a metal sensitivity, this is unlikely to be suitable because it's actually got metal electrodes there. So I was fine with using this for ages, and then I developed a metal sensitivity which caused my skin to ulcerate, so I can't use this clip anymore. Fortunately for me, I have a friend called David Bastians who is a physiotherapist and an inventor, and he offered to design an alternative tragus clip. So this is what he has come up with, and I've been testing prototypes for a couple of years, and these have now been approved by the Therapeutic Goods Administration in Australia and are available for sale worldwide at tragusclip.com. The features of this clip that might make it more suitable for some people include the fact that it's made from electroconductive plastic, so the electrodes are this plastic rather than metal. It has this support wire here, which you bend like this, which hooks over your ear to help to hold the clip in place. And this is the bracket that sits at the front of your ear, and this side sits inside your tragus. And it also has this customizable pressure option. So the force that's being applied here is coming from resistance from magnets that have been embedded in the arms of the clip here. And the clip comes with additional magnets that you can add on to increase that pressure either on the outside or on the inside, and that increases the pressure. So a lot of people do have problems with clip pressure, so this clip starts really soft, and then you can build it up as you need. And as you can see here, it just fits straight into a standard TENS lead wire. And then you can hook that over your ear like that, and it's really secure. So if you've got a small tragus, that will hold it in place regardless of how big your tragus is. And this connection part is compatible with the Parasym device. Parasym, obviously, in their instruction manual advise against the use of other electrodes, which is perfectly reasonable. I can't use the Parasym without an alternative electrode, so I've made the decision to do that, and I don't have any issues with David's clip, but that decision rests with you, obviously. The side that you stimulate, most people tend to do the left because most of the research has been done on the left, but you can do either side. If you're going to buy one of these with the hook, there is a different one for each side, or the universal one has no wire on it if you prefer that. So that's your options with ear clips. There are other options and configurations, and if you're looking for an alternative, I'd encourage you to check out A Vagus Adventure by Dawn Wiley. It's a Facebook group that has a lot of information from people using this therapy. So, to set up a standard TENS device for tVNS, the first thing to be aware of is that not all TENS devices are actually suitable for tVNS. So there are a few essential features. Firstly, you need it to have customizable programs, and not all TENS devices have that. Some of them only have presets. You need the capacity to increase the output gradually, because you need a very low intensity range for tVNS. So the Parasym has a very sort of slow and gradual increase, whereas a lot of off-the-shelf TENS devices are like this, and for some of them it's actually impossible to get that control at that really low level. It should be easy to program and to use so that you don't make mistakes in how you use it. And A Vagus Adventure Facebook group by Dawn Wiley has information on some devices that people have found quite good for tVNS. So there's a couple of suppliers that are selling devices preset for commonly used tVNS settings, and that includes TENS Machine UK that sell a MedFit TENS device for tVNS, and also tragusclip.com sells a device that's preset. So these are the settings that are commonly used for tVNS. So the mode should be constant or normal. Those terms are used interchangeably. The pulse rate should be around 20 to 30 hertz. So that's the rate that is most commonly used in research. And the pulse width. Now, the pulse width that is most commonly seen in research is around 200 to 300 microseconds. However, one issue with that is that it can make getting that low level of intensity quite challenging on a standard TENS device. As such, you can reduce the pulse width to 50 microseconds, and that will drop back the intensity of the device overall and make it easier to get control. And it should still be stimulating the nerves that we're wanting to hit with the stimulation. So both of the pre-programmed TENS devices that I've discussed are actually set to 50 microseconds for that reason. So to administer tVNS, you need to be able to set the intensity. So to do that, you need the mental capacity to be able to do that, and you need intact sensation so that you can feel the stimulation and not put yourself at risk of burning yourself. So the first thing to do is to just clean the area gently. I use a tissue and a little bit of water just to get rid of any excess oils. Then you apply your electrode. So I'll just use the Parasym as an example. Just click it onto there. To set the intensity, Parasym recommend that you increase the intensity gradually until you can just feel it. And then once you feel a slight tingle, you just back it off until you can't feel that tingling anymore. Parasym suggests using this without any additional water to start with for conduction, but if you're not getting good conduction, you can just dab a little bit of water onto the tragus. Other people use saliva or conducting fluid as an alternative as well. Anecdotally, some people prefer to lower the intensity even further because of side effects. So I guess just the thing to be aware of with that is that nerves have a threshold at which they fire, and if you lower it too much, you may not actually activate the nerve at all. So an alternative parameter that you can use to try and reduce or manage side effects is time. So reducing the time is another way of achieving that. So in terms of the duration, I would recommend just starting with 1 minute and seeing how you go. Some people are very sensitive to that, to this therapy, so that would be my suggestion, and then build it gradually up over time based on how your brain and your body are responding. And look, there's a huge range of use with this therapy. Some people use it a minute a day, other people use it 2 to 3 hours a day. So it's a big range, and it's really about finding out what suits you. For myself, I use it twice a day for 30 to 45 minutes each time, roughly. Anecdotally, also, some people report if they use this too late at night that it may affect their sleep. So if that happens to you, use earlier in the day may be better. But it just varies from person to person, and I'd recommend documenting your experiences so that you can get a sense of whether this is helpful for you or not. So in terms of safety and side effects, a 2018 systematic review of tVNS found that only 2.6% of people discontinued use due to side effects, and this is the list of what people commonly experienced. So I guess from this we can say that tVNS is relatively low risk, but there's still a lot more we need to know about this therapy. Anecdotally, some people report feeling a little bit wired or a little bit agitated or emotional after using the therapy, and in response to that, I would just say go low and slow with this, and it does take time for the body and the brain to adjust, and some people do seem to be very sensitive to this. So for further information on safety, including populations for whom this may not be safe, I'd recommend that you look at the Nurosym Device Quick Start Guide, and seek advice from your doctor if you're experiencing any side effects, and discontinue use if you experience lightheadedness, dizziness, chest pain, or excessive skin irritation. So in conclusion, tVNS is a therapy that has potential application in a broad range of medical conditions, and it can be delivered with devices that are specifically approved for tVNS or through the use of off-the-shelf TENS devices. For further information about tVNS, please check out the links that I've included in the information description box below. And as always, please consult your doctor first if you are considering this therapy for yourself. Thanks for watching, and bye for now.